Hello and welcome to Your Medicine, the program that helps you make more informed healthcare decisions and keeps you up to date on current healthcare topics. I'm your host, Dr. Jeff Collins, Medical Director of ConvenientMD. Today I'm happy to welcome Susan Olson. Susan is a registered dietitian and Program Director of the Nutrition and Diabetes Programs at Derry Medical Center in Derry, New Hampshire. Welcome, Sue.
Hi, welcome. Thank you for having me.
Sure, absolutely. The first thing I wanted to ask is how one actually becomes a registered dietitian.
Well, I have been a dietitian for 30 years, and I went to Framingham State College, and at that time they had what was called a coordinated undergraduate program. They accepted so many people per year to do their academics and clinical during the 4 years. So that's the fastest way if they're programs like that out there. The other way is after you get your 4-year Bachelor in Science degree in food and nutrition, you are going to apply for an internship. So typically you'll do a 1-year internship and then you're eligible to take the registration exam. And I know there's a third way that involves your master's degree that I'm not clear on exactly how that goes either, but yeah, so.
And in New Hampshire, if one wanted to see a registered dietitian, how do you go about it? How would a patient go about seeing a dietitian?
Typically, the easiest way is through your provider. Usually your provider, physician, primary care is going to be utilizing somebody through maybe that works within your facility or the local hospital, or there are a lot more dietitians now in private practice, so they probably have a list and some referrals for you. And a lot of patients know that within their insurance they're going to have a list of providers that they can utilized, and they'll probably look for whoever's closest. Great.
Now, nationally, I know registered dietitians are in high demand. Do you get that sense in New Hampshire that it's really still a high demand field?
It is. It's definitely expanding. Like I say, over the years, having watched things change. When I started out, dietitians were typically, I would say most of us were on the clinical track, which meant you went to the hospitals, you did your time in the hospital, so you got your medical nutrition kind of background. There were some dietitians that went into administrative, like food service, some went into research, some went into clinical, community nutrition. So I think that all those areas have expanded, as well as a lot more niches in the way of wellness. And again, physicians are really utilizing them in their offices, and all of these wellness kinds of centers and whatnot are growing.
Absolutely. And so, as a physician, you might get 1 week of nutrition teaching in medical school. And so one of the things I found in my practice is that we really come to depend greatly on nutritionists to really help us in, managing patients, especially with chronic diseases. And so I wondered if you could tell maybe a little bit if a diabetic patient showed up at your practice.
Yeah, I mean, where I am, typically, again, the physicians with their schedules and what they're seeing and doing, lifestyle, nutrition, and weight are always a part of what they're dealing with. And like you say, unfortunately, in terms of time and being able to do a lot of education or getting patients information, it's a great service. And again, this idea of a team and having a network to work with. At our center, the model has been that doctors will refer them to our center, and we set up the appointment, and our goal is to try to get them to work with us for 3 months. There's that sort of 12-week model that looks like if you can stick with us for 12 weeks, we can make some good changes, we can get some things happening, and then I'm going to segue you back to the doctor, because we may be looking at labs or some measurable things. So it's sort of a segue or link of care that's working nicely. But it starts with getting the doctors educated and making it part of their visits to remember to bring it up. And again, many times patients aren't ready on the first suggestion.
Right.
We have patients when they get in, and I ask them why they're there, like diabetics. They say, well, Dr. So-and-so has been telling me about this. He's given me flyers every visit, and finally I'm ready. They get to the point of, and sometimes they have a good relationship with their doctor, so that to go and work with other people is another, gap that takes some time. But
so I can imagine it's complex if a diabetic comes in and really has poorly controlled sugars, where you're going to have to be pretty intensive with them over that 12-week period. I mean, how often would you see that diabetic who might be out of control with sugars?
What's evolved over at Derry, I've been there 13 years. I was just their part-time dietitian, and about 5 or 6 years ago, as a group, we looked at, boy, we're a big place. We probably could be doing a lot more in the way of intensive programs. It can be a little frustrating as a dietitian, one-on-one visits to, be going over your typical stuff, food pyramid, and feel like, geez, I hope I made a little impact. I hope that, something happens here. And I knew there were programs out there, nothing I've invented, that could be brought in that could, again, give people more tools and intensive, comprehensive things to work with. So we've evolved into some specific programs we run that are based in weight loss, based in lifestyle medicine. We have a diabetes specialist practitioner at our office, Jim Harris, who's just diabetic patients.
Oh, wow.
And he works with his own dietitian. Lori Muller is our RD CDE, she's certified diabetes educator. Mm-hmm. So they, as a diabetes center of New Hampshire, are doing a lot of good things and support groups. But they utilize me and my team. So I have a whole nice team of health educators now that are, again, the people who are there to help coach and support patients. So we refer back and forth and sort of look at, what's going to be the best fit for you, because my belief is there's more than one way to lose weight. Mm-hmm. There's more than one way to get healthy. These programs are going to offer you tools, and my world's becoming a lot more of what is called meal replacements, mm-hmm. meaning, if your patient doesn't have the time or wherewithal to make a low glycemic meal, guess what? It does come done for you. And mm-hmm. so we can look at, again, what option's going to fit for you for time, for money, insurance benefits, and what are your goals? So you're right. Diabetics are challenging. They've been struggling with, Lori and Jim are good at really the basics of the diabetes self-management, education and monitoring and again, because of doing this, like I say, it's really changed the way we look at diabetes. It's not one treatment, one diet, one medicine. It's really about what works for you and how you learn to manage these things, as you have a lot more power to control this. But,
absolutely. You had mentioned the food pyramid, and I know there was a little bit of confusion a few years ago when they went to actually a plate kind of concept. Could you just talk a little bit about that?
Mm-hmm. And I can go back even further than that, Jeff. There's the box. There was the box
sure.
of the. You might remember that too. It's the four, and then from the box became the pyramid, and the pyramid was a model that was meant to say less animals on top, meat and dairy, more plants on the bottom. Mm-hmm. So that's a low-fat, high-fiber. So as a general message, it was a good idea. But what happened, or what evolved, was the grains on the bottom looked like, okay, more grains. People like grains. We ate more grains. And the problem with the grains we eat is they're just too white. Right. They're too big. And so that's sort of the wave of some of the carb issues that came about. So from the food pyramid, like you say, the kids now have their healthy plate, but I use it for my adults, and I did not bring that. But the healthy plate is a real simple, easy model. It's two messages. It's a smaller plate. Portions is a big issue, obviously. So we've gotten into trouble with things we're eating. We're eating on platters and big cups and bowls. So this healthy plate is saying, more of a lunch or salad size for portions. And then, of course, it divides up the foods. Half the plate is vegetables, plants, the fruit, vegetables. The other half of the plate is your protein and grain. And we'll often use things like the fist or the palm are good gauges. So it's nice because it beats weighing and measuring, So yeah, that's a simple tool that's out there. Yeah,
it's interesting when you mention these different tools, because a lot of times you can empower people by giving them tools, but a lot of it has to do with actually changing patient behavior. And so I find it fascinating that you involve other people, along with the dietitians in this process.
Yeah. Well, and that's exactly right. I think the frustration can be, typically in my job with the science. You can spend time looking at, okay, this is your medical history, this is where you're at medically, and then you're trying to help them understand how their habits, behaviors, diet, what a big impact that has on what's happening in the body. And they often have to be either a little uncomfortable or scared enough to be ready to make some changes. And so so I do have to spend some time on the science. I say this is all great information, nutrition, calories, but the reality is eating's a behavior, and it's a habit, and we like our habits. Whether they're good or bad, we tend to gravitate towards what's familiar and comfortable. So it is a challenge to get people to move out of their comfort zone. So as I joke about being the food lady and having a good handle on the nutrition with the medical therapy, my health educators are great. They're most of them have backgrounds in fitness, and they're good coaches in the way of, we say there's the knowing. Most of us know what to do, and then there's the doing. Right. So to coach and support and accountabilities, when you have to weigh in and check in and keep food records are a big part of success when you look at all the people who've done well. Most of them have some method of tracking. Today, people are, it's like everything else, getting more high, their phone apps and whatnot. But it's a way to make them accountable to what they're doing and start to, move in that direction. So, yeah.
One of the interesting things with nutrition is we do often think about it in terms of diabetes and people with obesity and weight loss and exercise, but there's a lot of medical conditions now that are very complicated that really involve nutrition, so as congestive heart failure, renal disease, things like that. Do you see patients like that in your practice?
We do, and a lot of, there's a program we work with called First Line Therapy that is part of a food science company called Metagenics, and over the years of working with them, it's kind of a model that's bringing us more to look at, instead of specific diseases, but more conditions and symptoms, and how, you're right, a lot of things are connected. And as somebody presents with the high blood pressure, high cholesterol, diabetes, the lifestyle treatment of a good diet, a little weight loss, and moving is going to help all of them because of, all this stuff is connected. And so a lot of the profiles I'll see will be the metabolic syndromes. Obviously, they represent a big piece of what we see out there. And the good news is we're identifying them and screening them earlier. We're seeing a lot more young people, which we're trying to really make some headway into getting young people involved with us. We've just hired 2 younger health educator, a first male educator, he's young, and a young dietitian to bring that population in. So we've got the metabolic syndrome conditions, and then the other profile, if you have to group them more, the inflammatory people, autoimmune, inflammation, endocrine kind of things. And so these kinds of therapeutic lifestyle programs are, again, geared to work with both of these, because the diets are, again, this traditional low glycemic diet you hear about is, that's the good news today. We're not fighting as much anymore about what we should eat. What I tell patients, whatever you read or hear or see, Dr. Oz, we're all on the same page. This concept of low glycemic eating fits for everybody because it's good for your weight, it's good for mood, energy, and it's how we manage a lot of these conditions. So these low glycemic plans we use tend to kind of naturally reduce grains, dairy, and sugar. Those can be some of the 3 inflammatory foods in some people. So as you reduce them, not cut them out, but as you cut back on some of these, people with inflammation can start to feel better. So we have some of these cool tools. One is called a health profile questionnaire, or we call it the How You Feel paper. It's really just asking you symptom-wise, how things are feeling, and you score it out with a total because you're trying to see inflammatory areas, or again, people with high numbers. Again, it's interesting, as people get older, as they score high on their digestive problems, joints, mood, energy, emotions, they don't sleep and they think this is normal aging, and it really doesn't have to feel like that, So it's a good tool, again, to see, wow, you start out at 100, and a few weeks in we check it again, and later we'll repeat it, and those scores come down very nicely just with some basic food changes. So those are ways you can, again, look at some tools, some profiles. We do body composition testing there now. It's I call it BIA, body impedance analysis, a cool gadget really that's just going to help you see more than the scale. As you know, people tend to live and die by the scale. And these plans or concepts are more rooted in teaching people body composition. When you say weight loss, you mean fat loss. Muscle's the good stuff we're trying to hold on to. So these machines can tell us nicely your muscle fat waters and your BMR, basal metabolic rate. So it's a trending tool. You get a baseline, and again, you can look at it over time to see what's happening there.
That's fantastic, because I think people always need to know that they can be healthier at any body weight, and really, with nutrition and exercise and getting healthier is really one of the things we're shooting for. One of the hot topics now in pediatrics is this concept of food allergies, and we sometimes think we're seeing increased food allergies. Do you ever deal with that in your practice?
Yeah, somewhat. I mean, I think that, again, in the realm of nutrition, there's been traditionally true food allergies where people are, allergic and have severe reactions and know they have to completely avoid early on. But then our patients, that might change based on their immune system. Or again, there's a whole realm of people when they have inflammation in the body, they seem to have intolerances that, this is where a lot of this gluten-free has become a big thing, that you may not necessarily be celiac positive or celiac disease, but somehow you're feeling better and things are happening better when you cut the wheat. And again, there's a lot of theories about, Americans not only do we eat too many grains, but the grains are too refined again, and the wheat we eat is different than wheat used to be, and a lot of things are about what's happening in the gut. So a lot of our work can be about how to help those symptoms around GI. Again, a lot of times people think it's normal to have chronic, indigestion, reflux, constipation, all these things. So sometimes we'll start there. How do we get things working better there? So these modified elimination diets can tell you a lot. And there's, as you know, a lot more out there in the world of gluten-free that makes this easier to do.
Right.
So it's one of the things that we try. We do actually detoxes. There are short-term and long-term eliminations of things that can help the body really, do, I call it, spring cleaning. We're all getting exposed to more toxins. What if we could, help remove some of those? So,
my friends who are nutritionists, one of the things they really deal with often is this concept of fad diets that just pop up. And so, now you're hearing about the paleo diet, these grapefruit diets, these high and low fat diets and things like that. As a nutritionist, how do you deal with people coming in just, wanting to know about the most recent fad diets?
Well, good question, and it's hard to keep up with them all. Many times I'm learning more from my patients. They show me about that. What's it like? Because I try not to shoot people down. I want to look at what they've done, and a lot of times when you're trying to align with somebody, you like to look at what have you done in the past? What have you been successful with? We don't necessarily have to reinvent the wheel here. We could tell me what it looked like when you were eating well and losing weight and felt good. So from there, we can look to, tweak it a little bit. But usually if it's a fad diet or if it sounds too good to be true, and many of these plans are based in water shifts. And I say, at the end of the day, weight loss is still a very boring calorie equation, So this is about how do we, cut a few calories and start burning a few calories consistently enough to make your body go to the fat stores. That's where some of my visuals come in. But I think that people they want something fast, they want something easy. Things like the paleo are not actually all that different. There's some overlap with what these, what we call our plans, a modified, whole foods, modified Mediterranean diet, right? Mediterranean diet, of course, has been a big plug, and we know there's good things about that. So, and the truth is many people have different metabolic profiles. Sometimes the diet that might work well for me versus you versus a runner, profiles can be, customized there.
Absolutely.
Yeah.
So. Yeah, I think the customization, as you mentioned before, is one of the fascinating things because it's really, details why you really need to see a nutritionist and get a unique plan for yourself. When I ask my patients about medicines, they're often not on medicines, but when I ask them about herbals and vitamin supplements, they'll have these long list of substances that they're taking. Right. How do you deal with that in practice when you encounter someone taking multiple vitamin supplements or herbal supplements and possible interactions and what that's doing for their nutrition and diet?
Yeah. Again, you're right. That's becoming a bigger area and field where people are liking and wanting the idea of how to use food as a medicine and nutrition, and thinking that, again, if I use supplements, that may be the thing that allows me to not have to use a medicine. Or again, if I'm not going to eat the food, maybe I could just take it in a pill. So, a lot of people are taking supplements, and I've worked with different programs, companies, providers in this realm of supplements because, a while back I sort of was introduced to the concept of optimal nutrition, which to me meant what if your body could get every day the right amount of everything you need and the right balance and the right amount specific to you? What would happen if you could do that? Well, of course, we both know the answer is really good things will happen because once you give your body everything it needs, it knows how to heal and repair and regenerate. And the challenge today is, again, food today is more processed, and soil depletion means nobody's getting everything in food anymore. So most providers will recommend the basics of a multivitamin. A nice A to Z multivitamin won't hurt. And then the other thing that's really big, of course, is the omegas, fish oils. The omega-3s seem to be, again, beneficial on many levels. And again, it's one of those things, nobody eats fish every day, so I say it's like cheating a capsule or two can give you some nice benefits. From there's a lot more you can get into, again, depending on profiles. If somebody has GI problems, I'm a big fan of probiotics. I like the idea of, again, many times as we get older, we make less digestive enzymes, and stress, poor diet, antibiotics, hormones can mess up your gut balance. But the basic education is supplements are not regulated, so it's hard to know out there in the world of supplements what's in something, how pure it is, how potent, where the raw materials came from. So like I said, generally we'll talk about, how to compare and look for things, what kind of safety. We don't want to overdo things. Again, Dairy Medical has aligned with this metagenics company because they are the cutting edge, I think, of food science in the way of understanding food in a medicine way. So they do make some pretty high purity, high potency products that, again, if you're on something consistently and it really is working on a cellular level, you're probably going to notice it. You're going to feel it sooner than later. I don't have a lot of patients come in and tell me, oh geez, I love that one a day, can't miss that Centrum. It's it's probably not hurting, but is it really giving you optimal nutrition? So again, we talk about eat as good a diet as you can. Get as much nutrition from food naturally. But today, where these food science companies are going, there are formulas that what's in them really can get you to a more optimal level of nutrition daily. And there are some of these things we use called medical food. It just means, again, it's low glycemic, but we might have plant sterols in there for your cholesterol and other specific targeted nutrients. Again, my posters, I'll show patients that food is information. This food you eat is not just calories. It is sending signals and information to your body that's really redirecting how the expression of things are going to go. So you have a lot more power than you realize.
Right. So it's very interesting that you mentioned that. I mean, some of these concepts you're talking about can be difficult for the patient to understand. Do you use visual aids to actually help people understand?
I do, and I did bring, this is my favorite. I use it with every patient. It is, again, a real easy visual that is two sides of the paper are showing you two different diets. On one side we have what might be called typical or SAD. You probably heard of the standard American diet is referred to as the SAD diet, which is SAD, or they also call this the brown diet. It's not a lot of color, as opposed to this side is more what we all tend to be working with, these Mediterranean diets. And so I tell patients, again, we all know that good or bad food long enough is going to look like this or this in terms of body type. So we are really, like I say, trying to change the information to know exactly on a cellular level what happens with food and how it can, again, change signals. And on this side, this food, again, is sending more signals of inflammation. And again, this insulin resistance is a big piece of what's happening as people increase their body fat. So I'll say, look, I may not be able to promise you a six-pack in 12 weeks, but I can tell you I can help reduce some of that belly fat because it's this, they call visceral fat or fat around your organs that's producing a lot of these conditions and inflammation. So it's where we can start to talk about color in the diet and healthy fats and again, some of these changes. But again, it's a tough culture. A lot of this is what's out there as we drive through and go places. So it's a challenge, again, of the environment. How do you find, the right things in your environment?
Sure. When we watch television, we're often bombarded with infomercials, again, on various products that guarantee that they're going to decrease inflammation or take away pain or help with fat metabolism. Do you have any ideas about that?
I mean, again, I think that there are a lot of companies and places that are getting on the bandwagon of nutrition, and so there are probably a lot of good, legitimate kinds of products out there, and I think the challenge can be how to decipher through and who makes it, checking credibility, and there are some of these other standards you can look at, GMP practices within a nutrition company, and the other bottom line we know is price. Sometimes my patients get very excited about their CVS fish oils, buy one, get one free. So, well, that's okay, but just remember that it's hard to know in terms of strength, purity, and if it's a good pure fish oil, you shouldn't be tasting, repeating, burping it either. So those are some things to look at, and so again, we'll talk through some of this, and something that's usually a better quality is going to cost a little more. So there are ways to look at that, but many patients do come in with their bags of things for us to sit down and look at, because again, the concept isn't more is better. If you overdo things, then that can be a problem. So we try to just get the right balance and the right amounts. The other thing that's big, of course, is the vitamin D deficiency is pretty rampant. I'm often surprised to see how many patients at any ages, and whether it's sun exposure or not, that are either anywhere from mild to really severely deficient. And so the doctors are good about screening, and then they recommending 1 to 5,000 units may be a thing to think about for lots of us here. So it is something that, again, looking at somebody's profile and what are you taking, how much, and if you're getting it here, do we need it there, and so that's.
Are there other nutritional deficiencies you see besides vitamin D?
I mean, some of our doctors look at different B levels, folic acid. Those can be a piece of it, and again, sometimes some of the other markers of things they look at can be things within nutrition that, as we are doing things better, you'll see inflammation markers and such improve.
We know from CDC data that about approximately 140 million Americans are overweight or obese, and we know from an exercise standpoint, based on CDC data, also that 90% of Americans haven't exercised within the last 30 days, and 60% don't exercise regularly. How do you integrate this kind of exercise diet model over at Dairy Medical Center?
Yeah, that's a good question, and the other program we run at Dairy Medical is called Weight Sense. It's a medically supervised weight loss program. If HMR is Health Management Resources, again, that like Metagenics, they've been around 30 years. A lot of research. I just came back from a training last week, so I've got all their stats new in my. And again, they always hit you with the reality, which is it's not good news. The numbers are pretty staggering. The 70% of Americans are overweight. I said, that means if you line up 10 people, 7 are overweight. It's not our genetics or our stress as much as it is the culture. Again, we live in a time unlike any other time where there's more high-fat, high-calorie food and less reasons to move. We're not farmers anymore. We don't have to. Life isn't that hard. So again, like you're saying, the equation of calories in and calories out is important. And a lot of our programs are based in. Often it's the calories in first. If we can get some good things happen with the food, the scale starts to move. You feel better. And then as you feel better, you're more apt to start to move. And we think about exercise as more the tool you'll need to keep weight off and help maintain this body composition. So again, the gals that work with me all have backgrounds in fitness, so they're pretty good at helping, again, taking people and see where they can move to get them moving more. We use some different gadgets, their kinetic activity monitor and other good tools to help you see how much you're moving. And I tried to, do the same role modeling last year, wore that little cam unit, and the goal was 20 points a day. And I realized for myself that meant either walking for an hour or if I kind of jogged, run a little faster, I could do it in a half hour.
Wow.
I like the quicker.
Right.
So from there, I started to jog, and from there, I said, well, maybe I'll sign up for a 5K. And so patients, when you relate that, sometimes some people get up and love exercise. Right? I think that's great. I really admire those people. A lot of us, I said, I might pay someone to do mine if I thought it would. So you have to sometimes fake it to, go through the motions and look at all your options. A gym is nice, but sometimes if you don't have the time, you hate to pay the money. So we tend to focus a little more on home options, but.
So I sat down with my staff and I said I was going to get to be with a nutritionist, and of course they had a zillion questions that they wanted to ask you, but I said I would ask one question, and the question was, in the medical field we often come home late from work and we tend not to eat well when we're about to go to bed. Do you have any suggestions on how to deal with that sort of late night craving? Yeah, that actually falls right into the realm of we tend to focus on 3 basic skills of healthy eating, and the first one is timing of food. So this erratic eating or meal skipping, it can be the first thing that is the undoing of habits and metabolism. So you're right. The structure of how to take your day is based in your waking working hours and how am I going to divvy the food up over the day. So you're right. A lot of people do pretty well during the day, but it's later things can fall apart. I have patients who eat good all day and blow their calories every night. So it's not so much that food late is bad, in terms of a clock or a time. I don't necessarily believe that you have to cut off at a certain time, but it's the concept of if you tend to keep letting all your calories fall late in the day, your body adapts to that and says, well, I better be safe and store this energy because, the daytime's slim pickings, but the good stuff comes at night. It's a metabolism problem. So we're trying to just find better things to eat at night, the amount you eat at night. But sometimes this is a digestion issue too. You don't want to eat too heavy. Yeah. So like I say, if you're more of a second shift person, you have a long day, there's nothing wrong with having a little something later. But again, you try not to fall into the trap of eating things that are going to, again, the white flour, white sugar is the thing we gravitate for, but something that would be better, more protein or something that's
feels better, you know.
Great.
But.
Susan, thank you so much for
You're
sharing this
welcome.
half hour with us. I could talk
Sure.
to you for
Yeah,
many
there's
more minutes on this
good.
topic, and I really
Well,
appreciate it.
I'll be glad to come talk to your staff or anybody who's
Absolutely.
interested.
And thank you so much for
Sure.
sharing the programs at Dairy Medical Center. I
Okay.
think nutrition's a very hot topic now, and I appreciate your time.
Good.
Thank you.
Thank you.